After years of working in workers' compensation and witnessing a continued lack of compassion, Paul Binsfeld founded Company Nurse, an innovative firm offering the services of a 24/7 triage nurse hotline for injured workers. As CEO, Binsfeld has watched Company Nurse grow more than 200% in just over 4 years, saving employers that use triage 15 to 30% on workers' comp costs in the first year alone. In this interview, Binsfeld sat down with Insurance Journal at the 2011 MarketScout Entrepreneurial Symposium in Dallas, Texas, to share his view on the triage injury concept and how it's making a difference for workers, employers, and the workers' comp industry.
Triage is a pretty simple concept. When an employee gets injured, rather than going off to seek care on their own or being directed by an unskilled supervisor, unskilled in terms of medical knowledge, triage is where an injured employee can speak with a nurse via the telephone, go through the symptoms that they're experiencing, and go through a triage process which uses a medical algorithm database and provides that injured employee with an outcome. So imagine a laceration. We're going to be asking questions about how deep is the wound, have you been able to control the bleeding, that sort of thing. And then with the outcome, or with the process, the outcome would be that they should be seen at a clinic or an emergency room, or here's some potential home care that you can apply. The challenges that I encountered when I first established the company include finding the first early adopters. There's a lot of doubters about the concept. I was told that this is already being done by insurance companies, which I maintained that it wasn't, and it just took perseverance and belief and salesmanship to convince people that this was a better way of doing things. Today, insurance are much more receptive of triage. They're finding it as to be the next thing to do in order to better control costs, but also to take better care of injured employees.
Binsfeld says nurse triage services come into the claims process much earlier on the day of injury and differ significantly from nurse case management services already offered by most workers' compensation carriers.
Nurse case management has been around for quite some time, and I like to call it damage control, but what that really means is that nurse case management takes effect after a claim gets to some predetermined level. It maybe reserves have gotten up to a certain dollar amount, or the injured employees had so many physician visits. There's some start button that an insurance company utilizes in order to determine when nurse case management should come into play. And the goal of nurse case management is to reduce the ultimate reserve on that claim and the ultimate cost of that claim. Whereas nurse triage is, we call it a day of injury service. We don't follow the claim forever. We are in and out within 24 hours. We are the first call they make. We gather data, we transmit that data to the stakeholders in the system, and then we're typically out of the equation there. For me, triage is the right thing to do because I had seen the insurance industry treating injured employees with a lack of passion or lack of concern for their care. And it was more about just keeping claims costs as low as possible, about returning dividends to employers, which is important. We want to make sure that we have economical programs out there. But my thesis was that if you take better care of the injured employee, if you wrap them with compassion and care at the time of injury, they're going to respond better to cost control measures. They're going to return to work faster. It's going to be a good thing for the employer, a good thing for the insurance risk-taking entity, the carrier, and it's certainly going to be a good thing for the injured employee.